BRACT is an acronym for the Behavior Resource and Consultation Team. We are a specialized service team within Shared Health, Mental Health, and Addictions that provides consultation, guidance, and support for individuals and teams affected by behaviors of concern. Generally, BRACT has two main service goals. First, to improve the quality of life for individuals living with complex mental health and behavior support needs and their families, care providers, and support services within the context of the individual's chosen lifestyle, values, and environment. Secondly, we strive to build capacity of health system services to effectively address and mitigate risks associated with behaviors of concern through the application of positive behavior support strategies and interventions. BRACT is a small team made up of 3 permanent people that all come from different clinical disciplines. There are 2 full-time clinical behavior specialists who are the face of BRACT. These are the individuals that you will likely be interacting with if you contact us. We also have a part-time clinical psychologist who specializes in behavioral psychology and applied behavior analysis. Finally, while our team does have an allocated part-time EFT for psychiatry, this position is currently vacant. We do, however, have access to a psychiatrist as we need. BRACT adopts a truly collaborative interdisciplinary approach, which means that all team members contribute to the provision of services to every request that we receive. In addition, we see all stakeholders, including the identified individual, the family, informal and formal supports, as being partners whose contributions are welcome and beneficial. We believe this approach provides optimal service because it ensures a more holistic and complete perspective on contributors to behaviors of concern and the best strategies for management and treatment of these behaviors. What BRACT does when we receive a request depends largely on the nature of the request and the needs of the identified individual and support team. Some of the activities we might engage in when consulted include completing a comprehensive behavioral assessment in which we collect and analyze data. Often we use this information to help teams develop a behavior support plan. Sometimes we can point people in the direction of already existing resources that they're unaware of. And we're also available to assist individuals and their supports through a transition or life change. Finally, we can provide opportunities for learning either by providing this through ourselves through in-services and presentations, or providing information about where such opportunities exist. We do not provide diagnostic clarification, capacity, competency, or eligibility assessments, comprehensive adaptive behavior assessments, or pharmacological treatment recommendations. We thought it might be good for us to let you know where we are coming from philosophically, so you have a sense of how we do the work we do. We have identified 3 main approaches or perspectives that we draw from in providing consultations. From recovery-oriented practice, this perspective emphasizes empowerment of the individual and their supports and values growth, acceptance, and quality of life. Recovery-oriented practice strives to build upon a person's and team's strengths and recognizes and facilitates the development of healthy, nurturing relationships. From positive behavior support, this perspective is based on applied behavioral analysis principles, and it assumes that all behavior is functional and that discovering the functions of behaviors of concern is central to ameliorating them. When a change in a person's behavioral presentation is identified as being desirable, only non-aversive strategies are used, those that cause the least amount of distress and which facilitate greater access to positive reinforcement. Finally, this perspective advocates for the expansion of behavioral repertoires, which is the teaching of a broader range of skills and responses, rather than focusing on reducing repertoires, which is trying to get the person to stop doing something by suppressing the behavioral expression through delivering adversive consequences. From person-centered approach, this perspective emphasizes the value inherent in all people, irrespective of their engagement in behaviors of concern. It also advocates for maximal self-determination within one's life, which is achieved by ensuring opportunities for choice. Also, when a person chooses to receive support, this is tailored to their specific situation, rather than a one-size-fits-all approach. Of course, like all services and programs, we do have some parameters that we need to work within. These include prioritize service delivery. We prioritize the requests that we receive both on the date of request as well as looking at the potential risks. This means that some requests will be addressed sooner than others, even if we receive them at a later date. Our involvement is time limited, and we will not be permanent additions to a person's support network. This allows BRAC to provide services to a broader range of individuals and teams. Depending on the nature of the request, we may be involved for as brief as 30 minutes or for as long as several months. BRAC does not provide case management, but rather serves as a support to the case manager. This means that we don't recruit stakeholders, secure resources, or arrange for services to be provided, although we often provide recommendations about these issues. Our team is available during weekday day shifts only. We do have some flexibility here, but it is dependent on the situation and the availability of staff. We do not provide a crisis response service, nor are we able to respond to anything that would be classified as an emergency. In these situations, teams are directed to access currently available resources. We do not provide direct treatment to individuals, although we may have suggestions of possible service providers. And finally, we have no magic, no silver bullets, no secret fixes, and no special powers. What we provide is a systematic, methodical, evidence-informed approach to understanding and treating behaviors of concern. Collaboration, from our perspective, is a key element in a successful BRAC consultation. For us, collaboration involves the following components. First, identify and engage stakeholders. Ideally, there should be representation from all parties who are impacted by a person's engagement in behaviors of concern. Second, encourage and facilitate input from a variety of perspectives, acknowledging that each perspective provides valuable information. Evaluate the needs of all team members and acknowledge their expectations. Finally, facilitate positive, effective, and respectful communication amongst team members or stakeholders. BRAC facilitates collaboration by doing the following. We ask that all stakeholders be informed and are in support of BRAC involvement before the request is submitted. Arrangements are made so that we can connect with a range of team members as appropriate. This includes ensuring that appropriate consents for sharing of personal health information is obtained from the appropriate sources before we can proceed with a consultation. Information about obtaining consent is available right when you complete our request form. We wanted to be more specific about what you can expect if you consult BRAC, and so we'd like to describe the following 4 service options that we provide. Courtesy consult. This is a brief and time-limited consultation with a BRAC member. Often these kinds of consults focus on discussing available resources or on determining whether or not a request form needs to be completed so we can complete a thorough behavior assessment. These consultations are usually one and done in nature. They generally involve a phone conversation or virtual meeting. Behavioral consultations involves BRACT completing a comprehensive behavioral assessment, which will involve gathering data from the individual and team. A formal report is generated with a list of recommendations based on a behavior analysis of the collected data. Recommendation support. This service is only available after BRACT has completed a behavioral consultation and has delivered a report. This involves the clinical behavior specialist meeting regularly with the individual's team to help them plan and implement the recommendations that we've outlined in the behavioral consultation report. Recommendation support typically involves a once-a-month meeting for a duration of up to 6 months. BRACT also provides education. This service involves BRACT providing an opportunity for teams to learn more about behaviors of concern and best practices for the management and treatment of behaviors of concern. Each education session is tailored to the specific needs of the request. We are often asked who is eligible for BRACT services, and again, this may vary depending on the nature of the request. Our mandate is to serve adults in Manitoba who have been diagnosed with a mental health disorder and who are engaging in behaviors of concern that negatively impact their quality of life and or the quality of life of other people in some way. BRACT involvement is most effective when the identified individual has a generally stable support network and residential living arrangement. A case manager serving within healthcare system services must be identified to serve as the point of contact for BRACT and who can facilitate the delivery of BRACT services. Finally, informed consent from the appropriate parties is required for BRACT to be involved. So when should you contact BRACT? A consultation with us can be helpful when an individual is requesting help to change their own behavior. An individual's behaviors of concern are inhibiting transition or goal attainment. An individual's behavior of concern is presenting risks to safety and well-being of themselves, others, and the security of their environment. The team is unsure of what to do regarding an individual's behaviors of concern. The team is struggling with implementing a consistent approach. The team would benefit from behaviorally oriented knowledge translation. So thanks for taking some time out of your day to learn a little bit about our team. We can be reached at 204-940-3681, and you can just leave a message. One of the clinical behavior specialists will return your call. And this is our webpage if you would like to check that out. Thanks, and hope to hear from you soon.